Chain Drug Review and Mass Market Retailers Video Forum.
Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to a special edition of our video forum. We're here at the NACDS Annual Meeting talking to industry leaders, and we're happy to have Jim Tsipakis of Giant Eagle with us. Jim, welcome.
Hi Jeff, thank you for having me.
All right, my pleasure. How are you going about building synergies between the healthcare side of your business and the food side of your business? We hear a lot of talk about food as medicine. Seems like a great opportunity for Giant Eagle.
Thank you for the question. It absolutely is a great opportunity. When you think about the customer or the patient or the guest in the store, it's the same patient. They don't see themselves as a food customer or a pharmacy customer. It's a customer. And that customer has different needs and requirements. So think about folks that are on new therapies like a GLP-1 and the things that they need, a diabetic customer, what they need. But it all is based on the basic of nutrition and nutrients. So people need food, and food is the beginning of everything. And what you eat and what don't you eat affects your disease state. What medications you take and what medications you don't affect your disease state and your health. So we believe in a food store, in particular in a food store, it's a great place to marry all those need states into one and to be able to service and take care of our customers.
And are the customers looking to you for guidance in that mesh of food and pharmacy?
They are. We have amazing pharmacists and clinical practitioners in our stores and our technicians. We also have, so on the clinical side, but we also have great practitioners, if you will, on the front side, whether it's in our produce or our fresh departments, on helping folks, whether it's a keto diet or you think of someone that's got Crohn's disease or something like that, where they need the literacy of their disease state, the products that can help them, and also helping people save money in these tough economic times and inflationary times. How do you help people save money as well along that journey?
You talk about the tough inflationary times. Are consumers changing their behavior observably in your stores?
Yes, the answer is yes. I mean, certainly when you look at cuts to public spending, if you will, when you look at everything costs more money. When you think of whether it's gas to fuel your vehicle, to the groceries, inflation. I mean, eggs. You've seen where eggs have gone. Because of the avian flu and all of these factors that are affecting. So folks are certainly in some cases trading down, and in all cases looking for more value and ways to stretch their dollar.
And you're looking for ways to deliver more value,
yes? Absolutely, absolutely. And we have a whole team that, including myself, that looks for everything we can do, whether it's more promos or whether using our loyalty program. How do we give folks more value and giving them an opportunity to stretch their pocketbooks?
And Jim, in the current economic situation, how are the tariffs going to impact what you're trying to do? it's
a very fluid situation, really. We look at it almost by the hour, by the day, by the hour. Tariffs have a significant it has a significant impact on our business, whether it's on the food side, or whether on the pharmaceutical side. There is a lot of concern, and really there's a lot of uncertainty how that is. What is certain is that our consumers are stretched, and anything that happens that causes prices, commodity prices or pharmaceutical prices to raise is a concern. So what we at our company, and I'm proud of that, try to do is find every possible way to support our guests without having to raise prices. But in certain cases, it's just unavoidable. If our cost of goods raised by double or triple, or whatever the percent is, so we monitor that. It's a case-by-case basis, and we're hopeful that there's more clarity. This 90-day pause on the tariffs was a sign of good relief. But really, I think everyone's trying to figure it out and navigate through for the best for our customer.
I understand you've just shifted your employee benefit plan to a new PBM. Can you tell us about that?
Sure. We are excited. We have a partnership with Empirics. We have moved our entire employee benefit to what would be called a transparent PBM, or a PBM that's all the fees and rebates and things are all transparent, so we understand where our costs are and we understand what our benefits are. And in particular, it allows us through collaboration and transparency, two things. One, to deliver better healthcare at the best possible price. And two, to incorporate our pharmacists, and we have thousands of pharmacists across our stores that are really experts when it comes to prescriptions and the use of those prescriptions. So how do we get people on the right drug at the right price, both for them and for the company? And we are excited to be partnering with a company that is going to help us along that journey. So what we see is our team members, our employees will benefit from better care, more efficient care. And as an employer, we're expecting to have better costs, where healthcare costs are the largest growing costs at most companies year on year. So this is an opportunity for us to do better there and to give back to our company and our team members.
And finally, a question that's much talked about here at this show is PBM reform.
Sure.
And the need for it and the prospects for it. What's your view?
I think, like anything, change is good. I think there's a push, rightfully so, for transparency. You know, from a PBM perspective, how are there more transparent models where all constituents on all sides of it understand where all the puts and takes are? You hear a lot about rebates, you hear a lot about things. So I think having a model that's more transparent, that both the group that's paying for the services and the group delivering the services all understand the puts and takes, and ultimately give better care, which should lead to better care for the people involved, which is the patient at the end. So I think there's a lot of exciting things happening, and you're seeing some models change, which I think is good for the industry and it's good for patients.
Yeah, well, they can't change fast enough. Thank you for your leadership.
Thank you.
And thanks for the time today.
Thank you, Jeff.
Appreciate
Thank
it.
you.